Hello friends, welcome back to Dr. Jaggis Academy. In continuation with the tuberculosis, here I am presenting the second video of the topic tuberculosis. Let's start. In this video, I will discuss the pathogenesis of tuberculosis, what are the different patterns of tuberculosis, then how we can diagnose the tuberculosis. So now first of all, starting with the pathogenesis of tuberculosis. That means how the tuberculosis actually develops in the human beings after the microorganism, that is mycobacterium, enters inside the human body. So first of all, we will discuss what exactly is the cause of the lung injury. Then we will study there is a development of type 4 hypersensitivity reaction. Then within this heading, type 4 hypersensitivity, how it develops. There is a sensitization of helper T cell, there is a release of cytokines, there is formation of granuloma, and development of resistance or the tissue destruction. So these kind of the things we will study one by one under the heading of the pathogenesis. So now first thing, what is the cause of cell injury? Now it has to be remembered that mycobacterium itself is not toxic to the cells or the tissue. That means the microorganism is not producing direct toxicity. So what happens actually? So when the microorganism enters, there is an activation of the immune response, and the immune response is the cell mediated, that is type 4 hypersensitivity. And that type 4 hypersensitivity, that activation of the immune response is responsible for the tissue injury. So remember, it is the immune response which is producing the tissue injury, not the microorganism by itself. So now, coming down to the development of type 4 hypersensitivity. Type 4 hypersensitivity is actually a cell-mediated hypersensitivity. So type 1, type 2, type 3, all these are antibody-mediated. But type 4 is different, it is cell-mediated. So what happens if there is an initial exposure to the mycobacterium? So there is a non-specific inflammation. So like whenever any microorganism enters, there is a inflammation. So there is no specific pattern of inflammation. So we say there is a non-specific inflammation, but within 2 to 3 weeks, this inflammation becomes much more specific and it becomes a granulomatous inflammation. And we can say there is an activation of the type 4 hypersensitivity. In this type 4 hypersensitivity, there are number of steps. So we'll study these steps one by one. So now first, coming down to the first heading, sensitization of helper T cell. I will show this thing with the help of a figure. Let's say the antigen enters inside the body. So antigens, first of all they encounter APC. What is APC? APC, they are the antigen presenting cells. Okay. So now this antigen comes in contact with antigen presenting cells. Now in the antigen presenting cells, there is increase in the level of interleukin 12. Okay, this interleukin 12 is very important. In the presence of interleukin 12, this antigen will be presented to T cells. How? So these kind of T cells, that is CD4 plus T cells. Okay, so these CD4 T cells, they are called as helper T cells. Now what happens? These CD4 T cells, they encounter the antigen, this antigen, with the help of this antigen presenting cells. So in another word, antigen presenting cell is presenting antigen to helper T cells. So what happens actually? So there is, in this process, there is a sensitization of helper T cells. So which is very important. So this is the first step in the type 4 hypersensitivity, sensitization of helper T cells. Second step, that is the release of cytokines. So now the helper T cells were sensitized. These sensitized T cells, they release number of cytokines. These cytokines cause recruitment of macrophages, recruitment of lymphocytes. So you can say these are recruited at the site of inflammation. So we can say there is accumulation of chronic inflammatory cells. So this is the second step. So now third step, formation of granuloma. So now, as I told, there is a recruitment of macrophages. These macrophages are round in shape. They change their shape and they appear like epithelial cells. That means they will appear like these cells. So now they are called as epithelioid cells. That means macrophages, they are changed into epithelioid cells. Now these epithelioid cells, they start accumulating. There is accumulation of epithelioid cells. So these epithelioid cells, they are surrounded by lymphocytes, but at the same time some of the epithelial cells, they merge with one another. Merging of some of the epithelioid cells, that will lead to formation of giant cell, that is multinucleated cell. In the meantime, these lymphocytes are surrounded by the fibrous layer and lead to formation of granuloma. In the previous video, tuberculosis 1, I told you about the granuloma. I am repeating this one. So this kind of the granuloma will be formed, which is characterized by the presence of epithelioid cells, then giant cell, this one giant cell, and then there is a rim of lymphocytes, these lymphocytes surrounding the epithelioid cells, and then there is a rim of this fibrous tissue, this fibrous layer, fibrous tissue is surrounding all. And in between there is a necrotic portion. So we say there is a caseous necrosis. So this is a typical feature of the granulomatous inflammation that happens in the tuberculosis. Now fourth step, development of resistance or tissue destruction. So now we have to, by this time I told that there is an activation of the immune response, activation of the type 4 hypersensitivity. Now that immune response has a dual role. What do we mean by dual role? That means this immunity has developed that tries to control the infection of the mycobacteria. It provides the resistance so that you can say the microorganism is not able to proliferate. But at the same time, as I told earlier, this immune response also produces the destructive response. So this is the protective response, this is the destructive response. So that is why we are saying there is a dual role of the immune response. So now whether there is a protection, whether there is a destruction, it depends on the extent of the spread of the primary infection. That means whether the primary infection is widespread or it is localized. So I am saying protective or the destructive response depends on the extent of the primary. I will discuss this thing in the next slide also. So whether it is protection or whether there is a destruction. So if there is a localized infection, it is localized to one center, then you will say immune response is mainly a protective. It is predominant. And immune response prevents the spreading of microorganism. But if this is a disseminated, it is proliferating, then immune response is more destructive and tend to produce a tissue injury. So now I will discuss different patterns of tuberculosis. Tuberculosis can be primary pulmonary tuberculosis. It means it happens if the person is previously unexposed or unsensitized person, means the microorganism has entered in the person for the first time. So what kind of symptoms will be developed, that is called as primary tuberculosis. So now I have written word pulmonary because mostly those symptoms are related to the lungs. Now second pattern, it is called as secondary tuberculosis. It happens when there is a previously sensitized host and due to the reactivation of the dormant primary infection focus. It means that there was primary tuberculosis. Now that was dormant for a certain period of time, that was inactive for a certain period of time. Now it has reactivated. So that is called as secondary tuberculosis. I will discuss primary and secondary in more detail. Third is the systemic miliary tuberculosis. So first I will discuss about the primary pulmonary tuberculosis. So now, primary pulmonary tuberculosis means the antigen has entered in the body for the first time. So there is an activation of the immune response. Immune response will lead to formation of localized lesion. Some destruction will take place in the lungs. So that primary lesion, formation of primary lesions in the lungs, that means we say there is a gone focus. A small focus will be there in the lungs. And later on, gone focus changes into gone complex. Formation of gone complex means now there is an involvement of lung parenchyma, lung tissue along with the lymph node. That means when there is only an involvement of the lung tissue, then it is a gone focus. But when there is an involvement of tissue plus lymph nodes, then we say this is a gone complex. In most of the time, okay, once the gone complex, gone focus, and for most of the time, immune response contains the microorganism. It prevents the spreading of the microorganism. These kind of lesions, they heal. There is a fibrosis, calcification, and it becomes a dormant. So that portion becomes fibrotic and the inflammation is contained. Okay, most of the time. However, if the person is having a weak immune response, this is not contained. Rather, this focus and complex, they continue to proliferate. So it will lead to primary pulmonary caseous pneumonia. So that means disease continue to proliferate in the lungs. Moreover, the disease will be disseminated to other body parts. Plus, it can be directly gone focus to disseminate, and ultimately it can lead to the Miliary tuberculosis. So there are two options: either the immune response will contain it, so it will become a dormant state, or it may proliferate, it happens if there is a weak response. Now, I am just using certain keywords of the primary pulmonary tuberculosis. So the purpose of the activated immune response is to prevent the spreading of microorganism. So macrophages engulf the mycobacterium, and at that point focus is formed, which is called as primary focus or the gone focus. So gone focus is basically a grayish white area, necrotic portion, and when we see under the microscope, a typical granuloma can be seen, in which there is a central necrotic portion. And when there is a combination of the parenchyma and the lymph node, we say this is a gone complex. So these are the important things: primary focus followed by gone complex. Now, secondary tuberculosis. As I told, it is a reactivation tuberculosis, so obviously it follows the primary tuberculosis. So it arises when the dormant primary focus is reactivated, and it happens when the immune response is weakened. So that means dormant primary focus, if there is a weak immune response, it is activated, reactivated, and there is a rapid growth of the lesions in the lungs that will involve the whole lobe or the lungs, and it will lead to formation of cavities. The tissue is replaced by the cavities, the tissue is destroyed, and then it may spread to different organs that may be in the form of the Miliary tuberculosis. So this is this pattern of the secondary tuberculosis. So now about the Miliary tuberculosis, I will not discuss at this point because I discussed in detail Miliary tuberculosis in the tuberculosis 1 video. So now, last portion of this video, how we can diagnose the tuberculosis in the patients. That is how we can go for the clinical diagnosis. So first of all, I am discussing this test, Mantoux tuberculin skin test. So what we do? We take a tuberculin, 5 units of tuberculin. What is tuberculin? Tuberculin is a purified structural part of the mycobacteria. So it is a part of a mycobacteria. So we inject this tuberculin into the skin of the forearm. Then we monitor it for 48 to 72 hours. And if there is a formation of induration means palpable and a hard area. Okay, if this induration appears in the skin and of the size approximately 5 mm or greater, then we say this is a infection is confirmed. And this infection, this kind of a test, it indicates that there is a activation of a type 4 hypersensitivity. It is a delayed hypersensitivity, that is why it is taking 48 to 72 hours duration. So this is the first test of the infection. If you remember in my first video of tuberculosis, I told you difference between the infection and the disease. So now if you want to confirm the disease, then diagnosis of the disease, then there are other tests. We can go for the X-rays. We take the X-rays of the chest, that is a very good test. Then we can go for the acid fast smear. That means you take this sputum, which comes out after the cough. You make a smear on a test tube on a slide. Then stain with these dyes, as I told in my previous lecture. And then you go for the microscopic examination. But you can go for the second test also, which is called as the culture method. In this culture method, what we do, we take out this sputum, and instead of direct taking this sputum and analyzing under the microscope, we take this sputum and we culture it. And we culture for 4 days to 12 weeks. And then once the culture is there, then we go for the microscopic examination, which is called as culture method, and it is the gold standard method. Another method is the nucleic acid amplification. So what we do, we take out the sputum, we amplify the DNA or RNA in the sputum, and we see whether it is a DNA of the mycobacterium or not. So in the upcoming video, I will discuss about the urinary tract infections, non-complicated, complicated, these kind of